Hey guys, my name is John Shazer. I'm a certified personal trainer and I'm here to help police officers feel and function at their best. Now today we're going to be talking about hip flexors and sitting in patrol cars all day. So if you are driving for 8 hours a day or if you're always in a patrol car, please watch the rest of this video. Whether you're sitting in an SUV, a truck, a car, you're going to be in a seated position like so. You might have the seat a little further back, but for demonstration purposes, this is what we got going on. The main thing is realizing that our legs are always in a flexed position, especially at the hip. And what can occur over time is the musculature or the hip flexors that are in this area that help you lift your leg shorten, because you're not stretching them and bringing them to that range of motion that they should be exposed to throughout the day. So for a normal 8 to 10 hour shift, even 2 hours can have a damaging effect on your hip flexors and your range of motion within your hips. So, the main reason that having tight, shortened hip flexors is a bad thing is it can fault your posture. Now, you've probably seen this time and time again, and it's what I call a duck butt. You got that overextension in your lower back, hence your lumbar spine, and your butt's sticking up and your cash and prizes are kind of pointing down towards the ground. This is technically called an anterior pelvic tilt. And over time, this can wear and tear on your lower back, it can cause hip issues, and it's just a plethora of problems that you can avoid. So what we're gonna do is a quick little myofascial release for the psoas muscle and the iliopsoas muscle, which will help loosen up the hip flexors and get you more so to a neutral pelvis position. So let's get down to the ground and start the mobility. So now that we're on the ground, what we're gonna do is grab a kettlebell, and it doesn't really matter what size. As long as it has a decent sized handle, you're good to go. But what we're gonna do is get up on our knees, and depending on what side we start on first, we are going to angle the handle of the kettlebell to that side. So right now, I'm going to do the right side of my body, and I'm going to angle the kettlebell handle at a 45-degree angle. Now from here, I'm going to place the handle in between my belly button and the top of my hip bone. Now doing this, you want to be very careful, because if not, gut smashing and belly smashing like this can be very discomforting, and I wouldn't want someone to hurt themselves.
I'm too old for this shit.
So the main thing to take note of is to keep your weight distributed between all two hands and both your feet. So we're here, I'm placing the handle in between my belly button and my hip bone. Now I'm just breathing into it. If you've never done this before, just being in this position already, you will feel pressure. And what you want to do is contract, exhale, and breathe into it. Making sure that you're not chasing the pain and you're just feeling a slight discomfort. You don't want to feel a sharp, excruciating pain. If so, take some of the pressure off and try it again. So here's a little side view. As you can see, my hands are bracing part of my weight, and so are my feet. The kettlebell is placed on a 45-degree angle in between my hip and my belly button. Now from here, we tack down the tissue. And the next step is to floss, which pretty much means moving the same limb through a range of motion. So if the kettlebell is on my right side, I'm going to take my right leg, bring my heel towards my butt, flex at the knee, and then extend. And then when you fish around and find some of those trigger points, you want to tack down tissue and floss, which is pretty much just moving your limb. Now you can also internally rotate and externally rotate your leg. You want to perform that for about 2 minutes on your right side, 2 minutes on your left side, and that's pretty much it. It should help release the tension in your hip flexors, open up that area that probably is damaged from a lot of hours of sitting. And that's pretty much it. So, be sure to keep updated, subscribe, and I will have more of these mobility videos and myofascial release exercises coming up for you guys and ladies in the blue. So keep on keeping on, and I'll see you guys next time.